This is really bright, but adjuvant sacituzumab, govitecan plus nivolumab for muscle invasive UC. So the patient population for this trial is basically mirroring the label for adjuvant nivolumab. So these are patients with muscle invasive urothelial carcinoma of the bladder or upper GU tract, including ureter or renal pelvis. These patients had curative intent surgery, whether it is radical cystectomy or nephroureterectomy. And at the time of surgery, they had high-risk pathology. So there are two patient subgroups here. One patient subgroup is patients who received neoadjuvant cisplatin-based chemotherapy. In that case, they're considered high risk if they have PT2, PT3, PT4, or PN plus disease at the time of their surgery. And the second subgroup of patients are those who did not have any neoadjuvant chemotherapy. And in that case, high risk is considered PT3, that was supposed to be T4, or PN positive disease. So that's the patient population. And then they had some kind of imaging after their surgery, and they do not have metastatic disease. So currently, what we have in our toolbox is adjuvant nivolumab, which is FDA approved based on the Checkmate 274 study in this exact patient population. We also have two other studies. One of them, in Vigor 010, was a negative study. It was a study with adjuvant atezo. However, in the subgroup analysis of that study, turns out that maybe patients with positive ctDNA benefited from adjuvant atezolizumab. So there is ongoing IMvigor 011, which is looking at the ctDNA positive cohort. So that's still in progress. There are no results. And then we also have the Ambassador study with adjuvant pembro, which was a positive study, but the drug is not yet FDA approved. So this is just the main endpoint from the Checkmate 274, which was disease-free survival. So here I'm showing you disease-free survival specifically at 6 months, which will become relevant later. But here you can see that with nivolumab, it was 74.9 months. With placebo, it was 60.3 months. And this benefit favoring nivolumab continued as time went on. However, we can see that there's still a need in this patient population because patients still recur and still die of metastatic UC. So this where the idea of intensification of adjuvant therapy comes in. So I know lately there's been a lot of emphasis on the neoadjuvant space, but I think it's also important to develop agents in the adjuvant space. So we already discussed that SG is a drug that has been, until very recently, approved for a metastatic UC. That's the molecule which we already mentioned. And we already mentioned that there has been a recent negative confirmatory phase 3 trial in the metastatic UC setting that led to the voluntary drug withdrawal by Gilead. However, there has also been a perioperative study, SURE-01, which has been presented at a recent meeting this year that did demonstrate activity of perioperative sacituzumab. And again, there has been an issue with neutropenia and several deaths secondary to neutropenia. So in the middle of the protocol, the dose of sacituzumab was lowered from 10 to 7.5. So the final results of this study are still pending. So here we come to my study. So this is a phase 2 single-arm study that will be conducted at several centers. And the patient population here are those patients who are eligible for adjuvant nivolumab, as per the Checkmate 274 patient population, and as per the label for adjuvant nivolumab. So these patients are now post their surgery, and you're considering adjuvant nivolumab in these patients, and they're either ineligible or refused adjuvant cisplatin-based chemotherapy. So the study intervention is nivolumab for 12 months as per label indication, plus sacituzumab for 12 weeks. So this study took a while to open, but has finally opened last week. So I'm very happy about it. We don't have obviously any data to share, but these are some of the endpoints of this study. So the primary endpoint is investigator-assessed DFS at 6 months. Some of the secondary endpoints are investigator-assessed DFS, investigator-assessed distant metastasis-free survival, OS, rate of ctDNA clearance in ctDNA positive patients, toxicity evaluation, and exploratory biomarker analysis. So this is a pretty small study. It's 23 patients. We plan to treat over 12 months, enroll over 24 months, and we're going to follow these patients for 5 years. Here I just wanted to highlight that the dose of SASI in this particular study is 7.5 to mirror the SHORE-01 data. And SG is given for 4 cycles together with Nivo, and then Nivo continues as monotherapy for 12 months. And that's all I have. Thank you so much.